Welcome to the Jock podcast featuring Dr. London Smith. Clinically proven to be the #1 top best podcast to listen to. Now introducing your host, Dr. London Smith.
Hello, and welcome to Jock, where we discuss fitness and health and how to incorporate our modern understanding of science and medicine into our daily lives, but without it being so boring. I'm your host, drlondonsmith.com. I would like to begin by apologizing to our listeners. We have received some feedback claiming that we are using an excessive amount of technical terms, such as spit and toes. So I'll try to simplify my terminology a little more in the future. Here to assist with that is our producer, Cameron.
Hello, friends.
Cameron feels the energy in the town, the nation, and sort of in the world beyond even. So be ready for him to chime in to guide us along as we go.
I have a certain connection to our listenership that maybe someone like you from more of an elite community wouldn't be able to understand.
Well, right. Well, I did spend my time. I've been a normal person for most of my life, but yeah, I do spend a lot of time in the hospital and all that. So
there's no way you could know what a normal person is like.
Well,
all you know is hospital people.
Well, okay. Well, also with us is DJ Dylan in the house. Wow. Plus, Cameron tells me that we have a guest coming on later who's an innovator.
We sure do.
All right, so look forward to that. Now, for a tale from the psych ward. I was speaking to a female patient, and I asked if she ever hears voices that aren't there. So this patient said to me, "Oh, I don't hear voices, but what I do got family members who enter my body physically because they's hungry for food. I don't see them all the time, just when I close my eyes. So I see them behind my eyes." And so as far as I was able to ascertain through my own observations, there were no other people in the room, and I certainly did not see a family behind her eyes, though I admittedly did not perform a fundoscopic exam to check for family members. All right, well, now for today's topic, myocardial infarction. It's more commonly known as a heart attack. So myocardial infarction is due to necrosis or death of the myocardium, or the heart tissue, and that's as a result of an interruption to blood supply. So this specifically occurs after a thrombotic occlusion of a coronary artery, which is the artery that supplies the heart. This usually presents in individuals who are middle-aged or older, and so it can present with chest pain during exertion, and often with radiation to the left arm or jaw. They can have shortness of breath, they can have sweating, weakness. It can present in a lot of different ways. It can have nausea, fainting, even just a sense of impending doom. But it can also be, asymptomatic in up to a third of patients, especially in elderly patients or diabetics or women. Myocardial infarction.
Dr. London, I hate to interrupt, but this word you keep using, I think maybe sort of inappropriate for a lot of our audience. You keep talking about mighty fart suction. And most of our audience at this point are under the age of 12 because of the way we've been kind of handling our marketing.
Okay, well, so I've been saying myocardial infarction.
It's the way you say it's. I think it's specifically the way you say it. There's something weird about it that I think is going to turn a lot of people off.
Because
yeah, so that's more appropriate than what you've been saying.
And you say we've been marketing to children under 12 years old?
Well, okay, so like a lot of these kids these days have these cell phones, right? Like every 7-year-old has an iPhone,
right?
Because we're so addicted to our phones. Mm-hmm. And so I've just kind of been like hanging out with them, and then I'll be like, "Hey, let me see your phone. Let me take a picture of you on your phone." Like,
you've been hanging
cool.
out,
and then I'll just open up iTunes, subscribe them to the podcast.
Well, that's good.
And then
that part I can see being good, but except that
let me get us. Oh, wouldn't it be cool if I took a video of you doing that cool trick on your scooter, and then I just download the podcast.
And you're just hanging out with these kids?
Well, yeah, like I'm meeting up with these kids.
That sounds odd. Okay, well,
I mean, it's for the podcast.
sure. So I figured because we're trying to appeal a little bit more. We're trying to appeal a little bit more to like physicians, to medical people. The
At least one of these kids tells me that they are a doctor. I don't know if I buy it.
well, you haven't.
But they did stitch up my arm.
Did you got into an accident and they just had the suture kit?
Well, we became, like blood brothers. When you like cut yourself and then you kind of like shake hands. And then they were able to stitch it up. I mean, super clean.
Stitch up. How big of a cut did you make for? Because Blood Brothers isn't a huge cut, right? Like I've seen it in movies and things.
Yeah, if you're not, a real blood brother, you might do it. If you're a tiny blood brother, you might just do a little cut,
like a paper cut. But you're saying that
But if you're really close with someone, you want to like really make ties with someone, then yeah, you might cut from like the top of your finger down to, like your elbow.
Okay, that sounds pretty dangerous. But you're saying that this child.
Yeah, this genius kid was able to stitch me up, super clean.
Did you call him doctor because of what he did, or did he claim to be a doctor?
Little column A, little column B.
Right. Okay, well, in any case, so myocardial infarction.
Just the way you say it, man. Ugh. God, it makes me want to throw up.
Okay, well, so it presents with chest pain during exertion, often with radiation to the left arm or jaw. And so it's not, to clarify, it's not fart suction.
Ah, man.
It isn't that.
Okay.
It's when the blood supply to the heart is interrupted. And so they can have shortness of breath, sweating, weakness, nausea, fainting. There are a lot of presenting signs and symptoms, but it also...
These are the same symptoms that I have when I struggle with fart suction. So it does sort of seem like...
It's something that you struggle with.
Yes, sort of the same thing.
Okay, what do you use for fart? Because fart suction, do you use a suction device, like a vacuum cleaner?
What are you talking about? I don't use anything. When I am struggling with fart suction, my left arm goes numb. Like everything you're talking about. Chest pain.
Okay, I'm not exactly following, but we can move on from there.
When you fart and it sucks something in, it's fart suction.
So when you fart, that's an outward gas escaping outwards from your body.
Yeah, I guess you could call it reverse farting. Why are we putting me on blast?
Only I'm just trying to make sense of what you're saying here. So you're saying that whenever you struggle with this issue,
fart suction, yes, which is a personal issue I wasn't expecting to talk publicly today, but for the podcast, I understand. I want to be able to help the community. It's still disgusting the way you say it. I was hoping by now you could maybe say it in a more polite manner, but
so I'll just say heart attack. I guess that's easier.
Yeah, that's great.
Okay,
when I'm having a heart attack, when I fart so bad it sucks something up. Go ahead.
I feel like yours is more of a digestive tract issue, whereas we're focusing more on the heart. So, but anyway, we can move on from there.
Okay, yeah, that's great.
Yeah. Okay. So, all right. I guess next we'd like to talk about. Do we have any sponsors today?
We do. Our sponsor is actually our guest.
Okay, the innovator.
Yes.
Okay. Well, hello and welcome to Jock Doc.
It's great to be here. Thank you for having me.
Mm-hmm. Well, my name is drlondonsmith.com. This is Cameron. What's your name?
My name is Brock Lee, and I'm here today to talk about a brand new app that should be coming to the App Store soon. It's actually called the Whiff app.
Wow.
Mm-hmm. Yeah,
Okay.
It's actually a funny story. About 10 or 15 years ago, I had a friend, and he tragically was born without the sense of smell.
Oh, that's so
Sorry to hear
sad.
that.
Yeah, he has all the other senses, and they're actually quite heightened. He's almost like a superhero in that way, but anyway, he just could never, just avoid eating things that had gone bad, and he was always getting sick because of rotten milk and things like that. So my heart really went out to this guy, and
I struggle with the same thing.
It's just ironic, but one day he was walking out of my house and he just said, "Smell you later," and like a bolt of lightning, it hit me. Someone needs to invent an app that will let you smell things on the other person's phone through like headphones or something. So we did a lot of brainstorming, and I dropped nearly $250,000 on this app to try to get it right. Yeah, it was a lot of trial and error, but at the end of the day, I got to the point where I was like, you know what, man, this is just gonna take off like wildfire. And so basically for the past, I don't know, 2 or 3 weeks, I've really just had people just 100% behind me, smelling everything that I'm doing, and they're like, yeah, man, they smell me, they really are, they're with it. But the Whiff app is basically just designed for people who can, just connect with another person because of what they're
so
going
hard
through.
to connect these days.
I mean, and really it is, but when you smell what that person is going through.
I have always said that texting is so less personal.
Right.
Because I can't smell what's going on.
You really can't.
This is really intriguing.
Yes. And so,
Well,
I'm sorry, go ahead. What is your complaint?
I don't have.
Let me get ahead of this.
I mean, I can hear it in
I
your
do want to
voice
say,
already. You're
I know where you're going to
criticizing my
go,
work.
Dr. London. You put in $250,000. Yes, $100,000 of that is your investment from your debit card that I had given him. You will be reimbursed once the app reaches a value of $1 billion or more.
Absolutely.
Yep.
Okay, that wasn't going to be my complaint, but no, now that is a very real complaint that I have.
I don't understand. I just told you you're going to get your money back.
Literally, it's foolproof.
Yeah.
You're going to get it back
Plus
once we
a
reach $1 billion.
1% interest.
That's
we
a good
can-
deal.
Mm-hmm.
Okay, so
Once it hits $1 billion.
so has this app? You said it's launched already. It's
We're still in some beta testing processes, but I mean, I've already had people, definitely out there.
In beta testing, that's when you test it on weak men.
Yes. It's not macho testing.
Yeah.
It's beta testing. Yeah.
It's not alpha. Okay. That sounds because normally beta testing is whenever you released like a sort of a partially finished product. You aren't sure.
Oh, I didn't know you were a technology expert now.
Yeah, and I just don't
That's
understand why
interesting.
you're complaining
Doctor
because this
of
is
tech.
really going to take off. Really.
Okay, so okay, could you tell me about how it works? Because as far as I understand, the technology of cell phones right now it's more sound and visual components, whereas transferring actual smells, it seems like you would have to more or less reproduce that smell on a given person's phone rather than transfer that same like the way you would do with a text or an image.
So let me just walk you through this because I feel like I have to really break this down for you. Basically, you're born with a certain number of senses, okay?
Sure.
One of them is hearing, so you need to try to do that a little bit. And then the other one is like you use visual, clues and things like that.
Wow.
And so, thank you. I mean, it is exciting to talk about your senses. And so, basically, this is going to access your nose, or as some people say, your snooter. And so you're going to be able to smell what the other person is doing on their side through the little speakers already on your phone. I mean, it's ingenious. It really works well. And so
So you use sound waves to access the olfactory the olfactory senses, because the way those work, to my knowledge, it isn't associated with sound. Like those are two different organs in your body that don't. The nose versus the ear,
right?
Like it doesn't.
Yeah, I mean, you would know more than I would because I'm not a doctor, but I do believe that
he definitely would not know more than anyone in this room.
Oh, okay.
He's sort of more of a Dr. Pepper type of doctor.
Oh,
Yeah.
okay. Like a Dr. Scholl's kind of doctor.
I think Dr. Scholl's was an actual doctor.
Oh,
maybe Dr.
okay.
Dre.
Okay.
Or
something along those lines, right?
Maybe Doc Ock.
Okay, yeah, Spider-Man. Big
Yeah.
fan growing up, big fan. The thing is, we already know what people are going through, with working out and things like that. But, there are certain times you're like, man, I wonder if that new deodorant's working out for them because we spent 6 hours shopping for a new one that wasn't going to make them break out.
You spent 6 hours searching for a deodorant?
doesn't everyone? I mean, you got to find that right, just the right one that'll just work for you. But I mean, you have a buddy at the gym and you're like, I wonder if he stinks today, and you'd be like, hey man, whiff that over to me real quick and just, I'll let you know what's going on with it, and
I am always, when I'm talking to someone on the phone, just desperately needing to know what they smell like.
Just in everyone.
I need it. I need that scent.
And the thing is, this makes so much sense. It makes $1, really, guys. I mean, it's just, it's easy. It's easy, because the thing is, the more senses you use, the better it works out. Because they say that when you're talking to someone, you'll remember things better when you have more senses involved. And so I was gonna go maybe the tasting route with things, but I just didn't want people to slobber all over their phones and stuff.
Like, to your credit there, for that point, the olfactory senses are supposed to be the ones closely tied to memory. So that is an argument in your favor. And I guess I shouldn't be so critical, since it sounds like I am thoroughly invested in this product.
Definitely invested.
Yeah,
very much.
For
so.
your sake, I would suggest trying to be positive about this. But I am excited about this. I mean, if I was able to capture smells, then I feel like it would solve a lot of this confusion earlier with my fart suction issue, because I'd be able to capture it and then show Dr. London, here's what's going on,
Right.
sniff.
Well,
Please smell this.
Right.
If it's suction,
Smell what's happening right now.
And the thing is, how many patients are in the same boat where they're having
Hundreds
farts
of
being
thousands.
sucked back in? I mean, it's got to be, at least 10.
Yeah.
At least. At a bare minimum.
and how much? And sorry, what was the app called?
It's called the Whiff app.
The Whiff app. Okay. Yeah, I know you'd said earlier something about whiffing it or sending a whiff or something.
Yeah, just whiff it over.
Okay.
And just imagine the medical uses for this technology. Imagine I have a tumor, and then I can just capture the smell of that tumor and just kind of text it to you.
Right.
Say, hey, does my tumor stinky?
Yeah.
Okay, well, that I don't know if that would apply so much, but there are some diagnostic things that having the smell does help.
Are my feet too stinky?
Right.
Well,
Is my hair stinky? These are things I could be sending you every single day.
I mean, is this a medical grade funk that I'm dealing with this smell? I mean, because, sometimes you really got to get an expert's opinion about what's going on.
And these doctors today in the medical community who think they know every single thing just based on sight and touch and education and knowing things, they're not even factoring in smell.
Right. That's completely
No
omitted.
doctor has ever factored in smell for any single thing ever in the world.
Ever.
Ever. And until now.
Until now.
I can see
And you're a part of it, really. Because, like he said, you're invested.
financially, at least, I am apparently a part of it.
You are also the spokesperson for it.
Yeah, we're going to have some paperwork for you to just...
Okay.
We'll deal with that in just a little bit.
Because that... Okay. Well, I guess a few parts of it... So telemedicine is going to be a significant thing. It's a growing sort of movement and business thing going forward. And smell is a small but still a part of what makes the doctor's visit something. If there aren't that many diagnoses that I feel like...
I have an idea for a billboard, right? And it's Dr. London, and he's sniffing on the app, and then he faints because it stinks so bad.
Ooh, that's good.
It's a moving billboard?
That's good.
I haven't figured out. I think it, like hologram cards where if you kind of turn them. So
I think they have that, yeah.
when you're, let's say, a quarter of a mile away, you're really just sniffing
hard,
the
I
app
guess?
just so hard. And then when you get about an eighth of a mile away, it's you falling over. Maybe there's birds flying around your head to show that you kind of passed out. Maybe there's stink lines coming from the phone. And maybe you're going, P.U.
That is stanky. That is stanky. Stanky.
How did you get that
Stanky.
sound bite? I don't think I've said that before.
That is stanky.
Okay. So from a telemedicine perspective, I can see how having
I don't
every
know.
sense involved...
I don't know what that is. And I don't care.
Okay, well, for our listeners as well, telemedicine is this basically the idea that you communicate with your doctor from your home instead of going to a doctor's office. And one of the ideas behind it is it can save you time and money.
That is the furthest thing from what we're talking about today.
We're literally talking about an app on your phone,
our
not
medically
doctor's
concerned
visits.
smells to our doctors, not whatever you're talking about. Just staying at home and having a staycation.
Yeah,
It
or
has
a
nothing to do with
staycation.
staycation. Oh, that's pretty good.
Thank you.
So Billboard says stinkcation at the very top. You're just sniffing the phone just so hard.
That is
Then,
stanky.
when you get an eighth of a mile away, it's you falling over, birds flying around your head that shows like you got knocked out. There's stink lines, and then it says, maybe it says stinkcation bigger. I haven't figured all of the logistics out.
So you're saying basically, as you're driving, someone's going to have to be staring at it as it progresses.
Maybe it
through,
can make a sound. Maybe it could go P-U,
or a smell,
P-U when you drive by.
a smell to your
I like
app on
that.
your phone.
Motion activated.
And since it's advertising the app, if it went to your phone while you pass the billboard, and then it. Anyway, I granted I don't work in advertising, so I'm not sure on that.
But just think
We
about
don't
it.
know
I
what
mean,
your job is. That I've been wanting to ask that. What do you do
Okay, no, I'm a doctor. That it's medicine.
for the podcast? You're a doctor, but like, what do you do?
No, okay, so the day job would be doctor, and then this is just a chance to reach out and help the community through education. So my actual job is doctor, like at a hospital,
Boring.
at clinics. Okay, well, for me, it's kind of exciting, and it kind of makes for a whole reason to do a.
P-U.
yeah, that stinks.
That stinks.
All right, I guess you. Don't, okay.
I mean, but you do make good money that we definitely have invested into this. So whatever you're doing, black market stuff, whatever it is.
What is your pipe dream for this app? Where do you want to go? What's next for it?
I literally want every single human being on the planet to be sending smells back and forth.
Wow.
I feel like we would all just know each other so much better, and not only that, but just if you ever found something super funky, just something that was just rank and you were like, man, that's a terrible smell, or like, the everyday average ordinary working man that Dr. London has no idea what they go through, like a garbage man or something of that nature. There's certain times I just feel like it would be so just essential.
Yeah, garbage man, sewage worker.
To know what that person went through in
Stink
their day.
factory man.
Like, hey, honey, check this out.
Now, and to clarify, you cannot send good smelling things through this app, correct?
I mean, you can, but really, like, who's going to
What's the
stop and
point?
smell the roses?
You
I
have-
mean, it's just.
Okay, so it's not like you have moderators preventing that.
I mean, right now, no. But I really feel like the point of the app is to get the funk, to really get the, the weird in the world.
I have another question about. So you said that this app was inspired by your friend who didn't have a sense of smell.
That is correct.
Are any of the proceeds going towards any sort of nonprofit for those who lack a sense of smell, or for any research or surgery, or?
I mean, at the moment, I basically just used him to get the idea, and we actually stopped talking because we were in a fantasy football league together, and it just didn't work out.
Yeah. That's really
but-
unfortunate.
You stopped talking because.
I'm really sorry about that. That's really hard.
No, and it was
Yeah,
hard
I
because
guess I'm sorry as well.
he drafted a running back that I really wanted
Wow.
in the first round, and I just knew that he was going to go off that year. But it, I'm sorry, it just still chokes me up because Adrian Peterson almost broke the rushing record that year.
Wow. I'm so sorry to bring up.
No, it was, it's definitely painful, and
But just imagine if your friend were able to send an "I'm sorry" smell
Without-
through your Whiff app. That
yes.
Not that he would know what it smelled like.
he could guess.
I mean, the thing is, okay, just all the cards on the table. He grew up in a family where everyone else around him was smelling things and being like, "Oh, you're missing out on how this roast beef smells," and he always kind of felt left out. But I mean, he's ancient news. I mean, I've moved on from him so completely. It's like, I don't even do fantasy anymore.
Yeah.
So just But the thing is, he can't smell, but he says it all the time, smell you later. And I just find that very confusing. But with this app, you know, he could find out from his mom or his friends, you know, hey, is my milk bad? You know, or hey, does this lasagna, you know, smell appetizing or whatever, you know? But
well, and I've been using on the app. You've got the stinkometer that ranks it.
Right.
That ranks the
you've been
ranks the
using the
stank
app?
from 0 to 10.
right.
And so that way I can tell, oh, this is pretty stinky, but is it stinky enough? And it'll
Right.
give me a gauge of whether or not I should make something stinkier before I start sending it.
So you're one of the beta testers.
Yes.
Okay.
Well, I had to have somebody to, you know, and obviously he's got a good nose for these sorts of things,
Yeah.
you know.
In a manner of speaking.
Oh, no, literally. Like, his nose is huge.
Gigantic.
It's perfect for this app.
Okay. Well, so I had we can move on to some listener feedback, and if you want to join in, you can help with that.
Yeah.
All right. So
Maybe you could, as you hear this feedback, tell us what you think this listener probably smells like.
I can do that for
I think
sure.
that'll really help.
I've really been studying
It
smells
could kind
lately.
of give people the benefit of knowing what something smells like when you hear it. Because I think we could really move this podcast towards kind of a smelly podcast.
Yeah.
okay.
Sort of a stink-based podcast would be
Right.
really good.
A stink-based audio format.
Yes.
Okay. All right. Well, so I'd like to address. It's just some feedback we received from a listener. Quote: "Tell your grandchildren to get off their depression meds and pray." All right. End quote. First of all, to that listener, like on my part, I'd like to thank you for contacting us at Jock.
And thank you so much for such a good idea.
Well, so it's always a pleasure to hear from our listeners. I just want to say that right off the bat. But in answer to that question, so it depends very much on the patient. There's some variability, but therapy for depression, like it does depend on what they present with. Like generally, you have cognitive behavioral therapy or some SSRIs, SNRIs, some antidepressants. They're just more commonly known as. So a lot of times you give them that, and so. But I will say that meditation and prayer sometimes can also be appropriate if that is effective in treating. All right. Well,
I bet smell probably would help with depression.
Definitely.
I have been wondering lately, my beer that I've been brewing, I had talked about it a few weeks ago. It's caused a lot of suicides, and I've been wondering if it's the smell.
okay. Well, there are a few things. So it's caused suicides.
I think.
One of the.
I can't guarantee that it's caused a lot of suicides, but a large percentage of our clientele have killed themselves.
Is it mostly a hops-based beer? Or
I just don't think the stench is where it needs to be.
Right.
Well, okay, because you had also described a number of things, but for one thing, similar to our listener base, you described them as being children.
For the most part, yeah.
Like, and not just like 12-year-old, but like 5-year-old children.
Well, 5 to 15.
In the beta testing, by the way, kids absolutely love this app.
They love it.
They're like,
Kids smell so bad.
they just rank, just like gross little things, but they love the app, you know. So I'll take $1 from anybody, you know. It doesn't matter.
Yeah, it doesn't matter.
$20
at all.
is $20, you know.
But so if you take it towards the beer thing, I don't think you should keep brewing this beer because it sounds like it's doing real harm to people.
Well, we don't. Okay.
'Cause
we don't know that yet. I'm just trying to suggest positive solutions to this problem. Right now, we have this beer that is not smelly enough, and we're seeing a lot of suicides. We're talking about, like, yes, a lot of these kids have dumped their antidepressants, and because I told them that the beer is sort of an antidepressant.
Well, okay, and declare
And
it
I
is
think
a
if we
depressant.
kind
It's
of
the opposite
increase
of
the smell, like really, really get a stink going for this
Yeah.
beer, it could do a lot for a lot of my clientele and a lot for the community.
I mean, one less person, you know, maybe you don't notice, but 15 or 20 people that are trying this beer and they're all of a sudden not there anymore, you know, you're going to start to see the economic impact for sure.
And I
know?
I am against suicide. I think you're maybe going on the pro for this. I'm
no,
anti.
No, No, suicide is not a good thing. But what I'm trying to say is, okay, no. Okay, no. So what I'm saying is that if the beer, you've already talked about how the beer is giving people like horrible symptoms in general, but now you're saying it's psychologically very much a depressant to the point that people are, and you're telling them to throw away their medication prescribed by their doctors.
Well, yeah, because I've got the beer. So why would they need to do both?
Yeah, you don't need an antidepressant and
antidepressants with my beer.
Yeah, and it
That's
says all the
mistake.
time. It says don't drink and take such and such medicine.
Okay, I agree with that. I think that the thing you should cut out in that situation is the beer, not the.
Well, that's gonna really hurt my sales.
I mean, and how is he supposed to make a living?
Yeah.
Through a job would be my suggestion.
This is my job.
Such as mine is
Brewing
the Whiff app.
buddy beer.
It's just we all have different strokes.
It's the beer for buddies.
Yeah.
It just needs to be stinkier, and I think that would really, really help a lot of these issues.
Well, and to clarify, so alcohol is a depressant. So it's not an antidepressant. It's a depressant. So that would be counterintuitive. So if they,
that's what I'm saying. If you took a depressant and the antidepressant, they cancel each other out. So get rid of the antidepressants. Really commit to the beer, and if it's stinky enough, you'll be okay. Because it creates so much joy.
And did you have other people's comments that dealt with smell, or I mean, what kind of information can I help you with as far as we're talking?
We haven't. Well, and as I mentioned, so this podcast is primarily audio based.
Right.
So there have been very few comments or reviews about the smell of the podcast,
Which is an area we're really lacking in. Which is I'm really excited for pivoting towards a stench-based podcast.
Right. I mean,
and
because that's the future.
Mm-hmm.
Everyone can smell it coming.
Yeah, I'm not sure if that. Okay, well, in any case, I think
I'll get you a case. I think that's where the issue is.
a
just
phone
need to
case.
You
try
haven't tried of Buddy beer.
Oh no, I do not want
I'm
that.
gonna get you a case of Buddy beer. Maybe you can help a little with my stink problem and try to come up with some ideas.
I'd like a case as well.
Okay, yeah,
I
we
definitely
I think
can
we
help
can
with
solve
the
this
stink.
issue. Yeah.
I don't. Yeah. Okay, well, in any case, I think that's all the time we have for today. Thank you to Mr. You said Broccoli.
That is
right?
correct.
Okay.
Mhm.
Yeah. Thank you to Mr. Lee for dropping by. Thank you to Cameron. Thank you to DJ Dylan in the house. All right. This has been Jock Doc.
See ya.
Adios.